Welcome, I'm Jon Caldara, president of the Independence Institute and your devil's advocate. A little later, we're going to talk about beer and the environment. Oh, it's going to be good. But first, a better look at our healthcare exchange. Katie McCrimmon, thank you for being here. Katie Kerwin McCrimmon, excuse me. There we go.
Thank you.
Get all the names in. You work for Health News Colorado. I get those mixed up.
That's
Health
okay.
Colorado. Health News Colorado
Right.
is what?
We are an online news site, and we strictly cover healthcare issues in Colorado and the Rocky Mountain region, mostly Colorado. So heavy-duty policy stuff, and it's been a lot of coverage of the Affordable Care Act.
Right, and it's interesting as a side note, just that after the demise of newspapers here in the Rocky, we're getting more specialized, good news services. There's, Chalk Beat that keeps an eye on Education Beat and Health News Colorado.
And we were modeled on Chalk Beat.
Yeah,
yes.
One of the things that Health News Colorado and you have done, I think much better than anybody else, is to keep a magnifying glass on the healthcare exchange here, Connect for Health Colorado. This is a big part of your beat. I want to ask you first of this audit they went through, and now they seem to be in more trouble, and it's costing me more because even though I don't go through that website, I have to pay for it now with the health care I get. So first, the audit. What was the audit?
Okay, well, they had a scathing audit, and believe it or not, that was only a limited one. And so the auditors, as we speak, are back at it, looking more closely at a much more global performance audit. They managed last year in the legislature to kill this, not this session, but
more of a full audit.
Yeah, this year now we're having a full audit, so they'll be going through everything. Before it was just very limited on some funds that were coming in, and one of the reporters who's regularly there for the audit committee said this was one of the most scathing he'd ever seen. So they found all kinds of potential problems with spending, and it was just a huge influx of money coming in and going out the door very fast. They got nearly $200 million in federal funds.
Now, how much was this Connect for Health Colorado, this exchange?
Right.
What was it supposed to cost? I mean, what was the original?
Oh yeah, the original estimates that they consistently said for years, $21 to $26 million.
$21 to $26 million. We're going to have this healthcare exchange where uninsured people can go and get matched up with the healthcare coverage they want.
And it's going to be sustainable by this year. It was supposed to be paying for itself.
Paying for itself by the people who actually use it, not just everybody else, but people who actually use it.
That's right.
So obviously the same people who worked on RTD's fast tracks must have taken over this project. What was the real cost?
Well, just this week we had the budget approved for the next fiscal year, which starts in July, and we are now up to $54 million. So
it doubled.
We're double.
Only double.
Yeah.
Only double.
Yeah, with a nice big bleed. Unfortunately, the revenues are not going to cover the expenses, and about $14 million over in terms of the expenses versus what money is coming in.
The promise, and by the way, there were a few people like Dr. Linda Gorman at the Independence Institute who said this cannot work, and it's not working the way it was promised. The thing that really got me was now it's not just people who use the site, but it's everybody who has health insurance that is now paying for it. And explain that to me. I want to make sure I got that.
Yeah, I think almost no one realizes this, that you're saying, maybe you've never even been on the website, you've never even thought about getting health insurance, but chances are you are helping pay for our health exchange. And that's because there are a couple different kinds of fees. There's this user fee, and that's supposed to be only on exchange policies. We'll talk about that in a sec. There's another one that they call the broad market assessment. This is on insurance policies for everybody who has health insurance in the state.
That's called the broad market assessment?
Broad market assessment.
Oh, I thought they only taxed women with that. All right, so the broad market assessment is that everybody who has any type of insurance, health insurance in Colorado, has to pay a fee,
You're paying
whether
a
or
fee.
not they used the damn exchange to get their insurance.
That's right. And the idea of that was that in the previous days, when we all were paying for folks who couldn't get health insurance, we had Cover Colorado. And that was how that was funded. And so it just kind of swung through and kept going. Now this one, they only get to do it for a year more, and then that gets cut off. So it's really going to be interesting to see how they're sustainable after that.
So then it's going to collapse.
Right. But another one.
Well, actually, let me ask you a couple things.
Okay.
Way back when, we all paid a little extra. Before the exchange, we all paid a few dollars extra for Cover Colorado, which was a high-risk pool. This was for people who couldn't get insurance because of a pre-existing condition.
They were too sick.
They were not left out in the cold. We had Cover Colorado, this high-risk pool. That went away because now we have the exchange. So you're telling me that the money we spent for that high-risk pool, which I thought worked incredibly well, is now going to this, and that's going to go away, that subsidy.
The subsidy is eventually going to go away. Yeah, it was supposed to just kind of help them get started, and then they were supposed to become sustainable with their user fees. And just now we're discovering that these user fees, it's fascinating, just finding this out, that they went way up. It was 1.4%, and we bragged here all over the country, the former executive director, that Colorado had the most affordable health exchange in the country with these very low user fees of 1.4%. So the board just recently voted to boost those up to 3.5%. But now we come to find out that those 3.5% fees, maybe the insurance companies may be charging those to everyone as well. So we're going to be finding out more about that. The legislature's getting a lot more active.
And we can't even say for sure, but if you don't use the exchange, and maybe you have health insurance through your employer, and you see how much he takes out, and that's only a portion of what he pays, and then whatever it is, 3.5%, you'd be paying less if the exchange didn't take this fee right now.
Right. So we're all paying for it. Now,
I'm glad they asked us. I'm glad that the Tabor law was in effect, and they said, hey, we should let people vote on this one.
Yep.
Yeah.
So we are all paying for it. Now, the idea is that if these folks were not covered, they might be marching into emergency rooms and racking up big bills, and we'd all be paying for it anyway. So there's some logic that, you know, we get more people covered, we give them more care, especially with chronic illnesses. If you've got diabetes or something, you want to have a doctor, you want to be getting care, and you want to be getting it
those are all
in the right places.
Great arguments.
Yeah.
But it doesn't compensate for lying to us, knowing that no way is this going to be sustainable, and it's going to cost twice as much, and the fees will be twice as high, not just on the people we first said, that first group who use us, but now we're going to have fees on everybody. You see, it's the lying part that bothers me.
Well, I think it's also the not paying attention part that is a little tricky. What
do you mean by not taking part?
Because this went through our legislature. We established our own health exchange. We bragged a lot that we had bipartisan support for this, so it was both sides at the table, and we started our own, and it seemed like a good idea at the time to have our own.
All of us who have been divorced said, you know, at one time this seemed like a good idea.
And then the next year, the bill went through that allowed all these ways of scooping up cash to keep this thing going. And again, you know, it went through our Colorado legislature. So it's a little bit like we've got to pay attention to what's happening.
There's been accusations of double dipping. What does that mean? I mean, I know what double dipping is, but how does that go here? I know some legislators are saying there's double dipping going on.
Well, it's that they're charging people twice. So if you're buying through the exchange, you are paying already this user fee. And then those same folks are also paying the other one, the broad market assessment. But now we're coming to find out that the people outside the exchange who are buying their insurance, they're paying possibly both as well. So we don't have 100% evidence yet. We're working on it, how this 5% thing is working.
How do they not know this?
Well, I mean, they grilled the head of the insurance commissioner this week, and you know, the lawmakers said they're taking much more of an interest in this, and even she couldn't quite explain, you know, exactly how this was allowed.
She being?
Oh, Marguerite Salazar, forgive me. She's our insurance commissioner, whose husband is on the health exchange board.
Well, that's cozy.
Well.
I love Colorado politics. That's very cozy.
Yes.
All right, so the woman who runs the exchange, her hubby is on the board.
Oh, no, different.
The
woman who runs our insurance. Yes, our insurance commissioner, her husband is on the health exchange board.
Right, but they have to work all to, got it. Yeah. Talk to me a little bit about the Supreme Court decision that could
yes,
come at any
day.
day now.
Yes, we're expecting it probably within the next 2 weeks.
Right. So
by the end of June.
By the end of June.
King v. Burwell is the case, and at first glance you might think, well, this has nothing to do
I
with
thought
us
it had
in
nothing
Colorado.
to do with Colorado, because let me see if I got this right, because
stay tuned.
this is for states that don't have their own exchange.
Right.
They use the federal exchange,
right.
and therefore if that becomes unconstitutional, they're in trouble, or they got to figure it out. But we were so wise, so smart as to create our own exchange. We got nothing to worry about.
It could have a lot of impact. So it's interesting. If the justices say that you cannot have those subsidies if you don't have a state health exchange, and it's like 4 words in the entire giant act, because you had to have your own state health exchange, it's possible that it could upend the entire Affordable Care Act. Because
one could only hope.
Without the money to buy the insurance, it's unlikely that people are going to keep buying the insurance, and that they're going to force them to do so still and penalize them. So on the one hand, states like Colorado and California, who had their own exchanges, thought, oh, great, we will triumph here, and we'll sell our technology to other states so they can really quickly establish their own exchanges. But our technology is not working very well. So why would anybody else want to buy it? So it's going to be really interesting to see what happens. Connecticut's been a little more successful at reselling their technology. So maybe if all these states, 34 of them, suddenly have to have their own exchanges, someone could benefit. But more likely, it's going to topple the entire Affordable Care Act, and Congress will have to step in, or all kinds of things will happen. So, and Colorado, the sustainability is really tricky. I mean, they're bleeding cash now. The estimates for the future years, out years, don't look much better, and they don't have an easy source to go get more cash.
It kind of sounds to me like the scam that Para does, which is we'll just make our projections so wonderfully rosy that it'll work out. Are there projections for Connect for Health so rosy that don't worry, we'll get enough users coming in that it's going to be fine? It's going to be fine.
They're pretty rosy.
Really?
Yes. They like to call them aggressive.
Aggressive.
But yes, so this year they got about 145,000 people to purchase private health insurance through the exchange.
Right.
One of the tricky parts is a ton of people are flowing in for Medicaid, and they're having to take care of them and not getting any money for taking care of them. So that's another issue.
By the way, nobody saw that coming. Amazing.
Yes, and the rosy projections show they're going to get a whole lot more people from small businesses who are suddenly going to want to navigate this tricky technology, and others. So
I tell you what, there's more to come. So if people want to follow it, it's
Health News, www.healthnewscolorado.org.
Healthnews.org.
Yes.
Thank you so much. You stay tuned.